Hi there, here to introduce you to the Ultima 20 TENS device. The Ultima 20 is a fantastic device. It's one of our better TENS device in terms of functionality. It's got a nice large LCD screen, so a big font, a lot of program data right on the screen. What's unique about the Ultima 20 is that it's got 20 modes of operations, 3 different waveforms, and a body part diagram that can kind of offer plug-and-play treatment options. So just choose the body part or joint, and it will have a preset program for that particular body part based on muscle mass and things like that. The device is very basic in terms of setup. It's got your on-off, your mode, your pulse width, your pulse rate, your wave, set your waveform, your timer, and your lock. That lock button will lock your settings. As well, it's got a cover for your top intensity knob, your controls up top. It's got a battery clip back here and a battery cover, or a belt clip and a battery cover. It's also got a nice sort of feel to this device, a rubberized feel for the Ultima 20. So it feels very nice in the hand. To use the Ultima 20 with TENS, there's pretty much 2 theories in which TENS works under. There's your gate control theory and your endorphin release theory. The gate control theory is basically all your settings maxed out. You'll choose your asymmetrical biphasic waveform, which is standard TENS. You'll max out your pulse rate, you'll max out your pulse width, and then you'll set your timer to about 30 minutes if it's your first treatment session. As far as your mode, you'll start on a normal mode. Once your settings are in place, you can then close your device and plug your lead wires in. The other type of program that your TENS works under, or theory rather, is your endorphin release, which is the same as your gate control theory. It's just with your pulse rate set below 75 hertz. So that can be tried as an optional treatment. Same thing with your modes and your waveforms. Those are all different options for stimulation. Everyone's pain is unique, so your settings on your TENS device may be better, or a particular setting may be better for your pain type versus another particular setting. So it's all very trial and error and experimental to the patient. But your gate control and your endorphin release theories are your basic setup starting points for treatment. Once you've got your settings in play, like I said, we're doing the gate control theory here. You plug your lead wires in. You're going to then plug your pin electrode pigtails into your electrodes. Doesn't matter which electrode. Your red is your active, your black is your ground. You're going to then plug your electrodes onto your body on the pain point. I do recommend using both channels. One channel can go right on the pain point. The other channel can go above the pain point or below the pain point. The electrodes can be placed horizontal, diagonal, or vertical. It's all up to you based on preference. Just make sure the electrodes aren't touching and make sure they're not too far spread apart. I like to say 1 to 6 inches. Once everything is connected onto the body, you got both channels hooked up, then you can turn your device on and set your intensity. Turn that intensity up to a level where you feel it, tickle, and then a little bit above that, but you don't want to be in more pain from the TENS device. After about 20 minutes, your body will adjust to that signal, and you can turn it up a little bit more from there. It's very easy to use. It comes with a nice soft carrying case here that's got a hard rim. Includes batteries, lead wires, electrodes, user's manual, and that's the Ultima 20.